Good morning. It's a real pleasure to be amongst you today. So my name is Charlotte Lindsay and I'm the Chief Public Policy Officer at the Cyber Peace Institute.
And hi everyone, my name's Emma Raffray. I'm the Chief Research and Analysis Officer, also at the Institute. It's my first time at Insomniac, so be kind to us today.
So the aim of today, we're really going to talk about the harms and impact methodology that the Institute has been developing. To do that, we'll take you briefly through who the Institute is, just as an indicator. How many people in the room have heard of or know of the work of the Cyber Peace Institute? Okay. And so I will give a very brief introduction for those who have not heard of the Institute before. And then we will walk you through some of the approaches that are currently used to measure harms and impacts and why that's important. And we will take some examples from the health attacks on healthcare sector, attacks currently in Ukraine, and then where we're taking this methodology and its importance going forward. So with that, I will just kick off on the Cyber Peace Institute. So the Cyber Peace Institute is a non-governmental organization based in Geneva, which is independent and neutral, and its work is very much to try to build stability in cyberspace and greater accountability towards against threat actors, and to support really vulnerable communities who are affected by cyber incidences. It's only 3 years old, the Institute, and we have a real multidisciplinary expertise. And that really looks at an evidence and data-driven approach to try to understand how we can assist particularly vulnerable communities. And in that, we have a Cyber Peace Builders program, which is supporting humanitarian and non-governmental organizations to build up their cyber security resilience. We also assisted healthcare, and also we look at particularly vulnerable communities linked to, for example, critical infrastructure. So that also helps us to gain primary evidence about how cyber incidences, cyber threats are affecting particularly vulnerable communities. And then we analyze that also along with open source intelligence that we gather and aggregate from a broad variety of actors and means of collecting data that we can really then look at analyzing along with that primary evidence how cyber threat landscape is affecting particularly vulnerable communities, and then we use those insights to inform policy and legal discussions that are happening, for example, at the United Nations to build a more stronger normative framework for the use of ICTs or against cybercriminality. So there are several ongoing processes at the UN and in other fora like the OSCE and others that are developing norms to strengthen the protections against the cybercriminality or the protections of the use of ICTs. So we work in this holistic way to really try to use this evidence to have an advocacy and policy-based approach to try to effect change. Why are we interested in harm? I think the critical aspect around that is that the current focus around harm primarily is linked to the operational or financial downtime and impact of a cyber attack, and all the public reporting obligations that are required in certain sectors or in certain countries, and that differs across sector and differs across country. And so it really is focused on what's the time to restore, what are the financial costs or penalties, what's the number of records that are breached, what is the personal identifiable information which has been accessed. What is not really the focus currently is what's the harm that is actually caused to people. And because there's really no standard methodology in place, that makes it very hard to understand those harms. And without a lack of real metrics, tools, and frameworks to understand and track that harm over time, it's very difficult to then work out how we can build stronger normative and policy-making processes reflecting that harm, how we can better support the victims of cyber incidences, and how we can learn for that in terms of building greater resilience. So that's what drove us to look at why measuring harm is important, so that we can then use that in that cycle that I mentioned in the slide previously around assisting those communities, analyzing the attack through a more methodological process, and then using that to inform diplomatic processes at state level.
Thanks, Charlotte. So, trying to put a bit of an analogy into place and how to actually differentiate a little bit what we mean by the terms impact and the terms harm. And I want here to use the notion of a car accident. We all know what a car accident is. It's an impact between two vehicles. A car accident can have different impacts. It can have an operational disruption. It can increase traffic at a particular time of day. It can lead to delays in you getting to work. It can lead to disruptions to services that have to intervene to be able to resolve the accident. It's got financial costs, and costs that really are impacting potentially both persons, both drivers of the car, in terms of the insurance that they have to pay and things of this nature. Then we look at the physical damage to the vehicles. What has actually happened in terms of actual damage to the windscreen or to the wheels? And then we have such things as geotemporal factors. How long did the accident cause a disruption? How big of an area did that accident actually lead to further disruptions? If we then look at the harm components of that car accident, we come at it from a human-centric approach, and we're looking at what was the physical harm that was caused to either the drivers or the passengers in the car or the bystanders who might have actually witnessed that accident. What does that mean in terms of potential psychological impact to the driver who might not be able to drive that car then for a subsequent lengthy period of time? We look at the community and societal impact, how an entire family has passed away as a result of an accident and how that impacts the community. We look at the reputational damage that could come from that if the vehicle was a company truck, for example, an Amazon vehicle that is then involved in an accident. What might be the result from that? And then we look at the environmental impact. Was there an oil spill on the road? How did that impact the environment around it? If we take that example and we sort of pivot that onto a cyber attack, we can see similar divisions. So if we take an example of an attack on a hospital, what is the operational disruption to that hospital's ability to deliver services? Have the computer systems gone offline? Has the website gone offline? Is it impeding the automatic opening of doors, for example? What is the financial cost to that hospital to actually recover from the cyber attack or to actually respond to the cyber attack in the first place? What is the physical damage that has occurred in terms of physical damage to the actual infrastructure, the technical infrastructure that was in place? And then how long did that attack go on for? How long were operations disrupted? Did it affect one hospital? Did it affect 50 different hospitals against 50 different states, for example, in the US, because they're part of a wider network? And then we look at the harm, and we look again from a human angle, from the people's angle. And here it's not just the patients who are affected. It is the healthcare professionals who are operating within that hospital, who are having to react in circumstances where they don't have access to patient data, where they don't have access to computers, where they don't have access to imagery, for example. And what are the physical or psychological effects of those particular, that particular cyber attack and the delays that it's caused in terms of access to patient care? And then there's the community and societal implications surrounding that. Has the hospital has to divert patients to another hospital, so it's causing a knock-on effect within a geographical perimeter of a city, for example. What is the reputational impact when critical data is leaked from a hospital and patient records are made available online? And what is the environmental impact if we take something perhaps a bit easier to imagine here, is a cyber attack on a water facility and contamination resulting from that? You know, what broader implications does that have? So taking in mind this kind of notion of impact and harm, we then started to look at what actually exists today. What is some of the literature, some of the studies, and some of the work that is being done by different actors, multi-stakeholder actors, looking at impact and harm? So we've got a report that was published by the ICRC, for example, that really looked at the effects of cyber operations in times of armed conflict. So it's a very specific use case relating to cyber operations. And they're really looking at an assessment of how traditional notions of impact actually rely on a risk assessment. And they look at a comparison of the likelihood of an attack taking place and the severity of those events. So in terms of severity, they're looking at the type of effects of an attack. They're looking at the scale and in terms of the people that are affected or the number of computers that might have been affected, as well as the duration. But then they actually look at the likelihood and what is the probability that a certain cyber operation actually causes the effects that they're assessing in the severity component. And not just looking at the likelihood of that happening to an intended target, but it could also be an impact that is happening incidentally or accidentally in the context of a cyber incident. What else exists today? There's a number of different companies, notably in the private sector, that are looking really at the business impact. And these are coming from the likes of Deloitte, but there's also insurance companies that have been doing a lot of work on this that are actually looking at the business impact. So what is the impact, for example, of a technical investigation that has to result as that results following a cyber attack? How does it affect public relations for the company? How are my insurance premiums going to change next year as a result of the fact that I've been a victim of a cyber attack and I've had to claim on that insurance? Have I lost any intellectual property when the cyber attack has taken place? But what we see in this report is these kinds of report is a significant a lack of acknowledgement that actually the cyber attack, beyond the organizational impact, is actually the impact that has had on people, be it, for example, their own employees, or be it their customers who might have suffered as a result. Then we looked at a report published by Unidea, which is actually a bit broader than looking at the impact and harm of cyber attacks, but it actually looks at a taxonomy of malicious cyber incidents. But there's a couple of components of that taxonomy that are actually really interesting when you look at the victim profile, where they talk about whether a victim is intended, instrumental, or collateral. They also break down the victim into different components. The victims can be an organization, but it can also be an individual within that organization, or in and of its own right. If we think about, for example, an individual whose phone has been targeted by spyware, that individual themselves is actually a victim of a cyber attack. They also break it down into what is critical infrastructure as a victim, what is a country as a victim, and we'll address this when we go on to the topic of Ukraine later on in the presentation. And then it looks also at international systems in place. But it also breaks down things such as targeted assets. And on the other spectrum, in terms of the output, what happens post-cyber attack? And they break it down into the effects, which is what we're calling impact on our side. But it also looks at the harm, where it's broken it down into physical, psychological, economic harms. But it also looks at gains, which is a really interesting aspect of it, which is looking what has the threat actor actually gained from committing that cyber attack. And for us, it's asking questions of, can that actually be transformed into some kind of measures of impact as well? If the objective of a threat actor is of a particular nature and he manages to gain something from the cyber attack, what does that mean in terms of assessing whether there's been a particular impact or harm? There's then the academic world, who've been doing quite a bit of digging into this, and they've actually started to propose some taxonomies or classifications of harms. And this particular study here breaks it down into physical, psychological, emotional, economic, political, governmental, reputational, and cultural components. And these come together and they're actually reused quite regularly now by different stakeholders and across different sectors in terms of actually used as classification of harms. But there's some open questions here. Can we talk about community and societal harm? Is that something different from the classifications that have been put in here? Can we talk about the disproportionality of harms, for example, when we're talking about particular communities targeted through cyber attacks. If we're looking at gender-based targeting, for example, how is that taken into consideration in the existing frameworks that have been put forward? What about environmental? That doesn't seem to quite feature there yet. Is it coming under economic? Is it coming under cultural, perhaps? And then there's some fundamental questions. How do we actually access and collect data to be able to understand this harm? It's difficult, and that data is not so easy to collect, and we're going to go through that in a minute. So the healthcare sector. So we touched on an example earlier, and the particular visuals here are on the two sides. If we imagine the car accident, we've got on the left the hospital fighting the cyber threat actors. It is the operational disruption. What is being done to actually contain that incident, to actually try to minimize the impact of that incident over time. And then on the right-hand side, we see what's happening to the patients and to the healthcare professionals who are operating with systems that are being disrupted or data being exfiltrated related to sensitive patient information. So since June 2020, at the Cyber Peace Institute, we've been collecting and documenting cyber attacks against organizations in the healthcare sector across the world. And we're doing this through open source data collection, and we've been focusing predominantly on disruptive cyber attacks, so notably ransomware. And we've documented up until September last year 501 incidents, specifically disruptive attacks against the healthcare sector. That's across 43 different countries. It's an average of 4.1 attacks a week, and that is barely scratching the surface. This is what we publicly know about. So what we decided to do when we were collecting this data is how do we actually start to define indicators to actually measure the harm and impact that these cyber attacks are having. And we're looking at global numbers such as 21 million records breached. We're looking at 1,400 days of disruption in total. And again, this is just what is actually known in terms of those incidents. So what were we able to actually capture from our data sets? We were able to capture from what is known. So there's a big question mark at the bottom of this slide. It is what about the unknowns? And there are a large proportion of the incidents that we've documented for which there's no publicly available information on the impact and harm that they cause. But on average, 163,000 records are breached during a cyber incident on the healthcare sector. In 13% of cases, incidents resulted in patients being redirected from the facility that they were in. And in 15%, incidents resulted in cancelled appointments. This is significant when we think about the number of people that would have been using those services and those resources during the time of the cyber attack. And then we look at the organizational side. 19 days on average of operational impact on that hospital or that healthcare organization's capacity to deliver its services. 52% of incidents led to healthcare systems going offline, which means limiting access to certain types of information, certain types of tools during a cyber incident. And in 70% of those cases, we're talking about disruptive incidents here, in 70% of those cases, the data was exposed or leaked. What can we draw from qualitative information? So there we were looking at the quantitative aspects. What can we numerically calculate? What is the qualitative data saying? So I'm not going to necessarily read through all of this, but I wanted to pick up some key words in the slide here. This is a real case example of a cyber attack against a hospital in France in August of last year. Medical images devices went down. Patient admissions were inaccessible. 700,000 people used that particular hospital. They were unable to register new patients. There was redirection to nearby hospitals. There were precautionary measures that were taken to transfer infants in intensive care. Precautionary measures. They didn't even know if the cyber attack would impact the ability for that child to receive care, but they had to take the precautions to do so. How do we start to measure these things? There was emergency care intake was decreased by more than half. Certain patients couldn't be operated on. There were 11 gigabytes of confidential data that made it online. That included scans, lab results, and social security numbers. Let's have a think for a moment what that actually means. That's one of those 501 incidents in our database. Who in this room has actually heard of Astamo? That's not very many. I'm hoping by the end of today you're going to remember them. They're a psychotherapy clinic that's based in Finland. And they were targeted in a system breach back in November 2018, which was followed up by another one in 2019. The attackers came back only in September 2020, contacting Vestamo, requesting 40 bitcoins to be able to protect that data so it doesn't get leaked online. They refused. And what happened subsequently was the actual targeting of specific patients who were requested to pay 500 euros for their data not to feature online. This resulted in Vestamo actually having to declare bankruptcy in February 2021. Staff and patients had to be transferred to new services. They were fined post-bankruptcy by the Finnish Data Protection Authority for violation of GDPR. And then there was a suspect that was named in October 2022, and they were arrested in February 2023. That arrest is extremely rare in terms of cyber investigations. The accountability aspect, which Charlotte will touch upon later, is actually extremely rare, that a cyber incident actually results in somebody being arrested. But this case had a significant impact on the Finnish healthcare sector, on the Finnish government, who had to revisit a whole number of different aspects of the way that they were protecting patient data, all the way to going through to new systems to actually allow for their citizens to actually have new identity numbers in the aftermath of a significant attack. So we've taken these kind of case studies as part of building a methodology where we actually break down the incidents into different categories, such as geographical, societal, operational, human, and legal impacts of cyber attacks. I won't go through the details just for the sake of time. So our methodology then is taking up the notion of identifying indicators of harm based on the quantitative and qualitative data collection that we're doing. And we break this down into different columns or categories of harm that could be applicable to any cyber attack, no matter what sector, what domain, what type of cyber attack it is, to indicators that are sector specific. So, for example, the healthcare sector, and then indicators that are attack specific, such as the notion of ransomware. A ransom paid is only going to be applicable in the context of a ransomware attack. And what we're then doing is identifying different weightings of indicators based on those notions of harm that we've identified. So we're looking here at raw numeric values that we could use as part of a future formula. We then also use categorical indicators. So here we mean we're transforming what would be potentially a yes or no answer to a question, or a category, for example, whether an incident is actually confirmed or possible. What weight does that particular category or value then hold? Converting that into a numerical value. And the next step, and this is where the methodology is work in progress and where we want to engage the community, is to actually figure out how do we mathematically combine these different indicators together to be able to compare incidents one against the other in terms of the impact and harm that they've had. There's also complexities with regards to this, and we mentioned this earlier, is how do we actually access the data? And if we're looking at certain things like the geographical impact of a cyber attack, the likelihood of us being able to acquire that data is actually very high. But then if we're looking at things like psychological harm, it's actually quite low. How do we go about actually collecting the psychological harm that's resulted from a cyber attack? So these are just some of the complexities and things that we're thinking about. I'll whiz through the work that we're doing on Ukraine. So since the beginning of last year, so in the month leading up to the invasion, we started to document cyber attacks and operations in the context of the armed conflict. And to date, we've documented 1,330 cyber attacks that have happened either against organizations in Ukraine, organizations in the Russian Federation, or organizations outside of the two belligerent countries, but that are taking place in the context of the war. And so here we're back to some quantitative numbers. We're looking at roughly 21 attacks a week, 87 different threat actors, 23 sectors impacted, 45 countries. But what we're starting to look at is how does the aggregation of these different cyber attacks together actually cause harm in itself? what is happening in terms of the persistent need for organizations to defend themselves, and the fact that they are operating in an environment where they actually have to expect to be attacked, and how is that impacting their ability to operate in terms of persistent defense? We've looked at also some of the qualitative aspects of what it means when organizations are targeted within certain sectors. So the energy sector, for example, what is happening when the electricity goes down? What is happening in the financial sector when we have cash machines that are not available for people to be able to withdraw their money? What is happening in the context of the media? And when we talk about the media, we're really talking about the impacting of informational space and how the information narrative is actually being skewed in the context of the conflict. And then transportation. What is happening when certain transportation networks can't operate, or when customers can't buy their tickets to be able to take the transport networks? So I've covered all of this, so I will move on to.
So, why is, if we look at something like the context of Ukraine or the healthcare or the humanitarian sector, why is it important to measure these harms? And what we see is that it is partly about busting preconceptions. If you look at something like the war in Ukraine, people will say that war is happening between Ukraine and Russia, but we've monitored attacks happening in 45 other countries, and those attacks are countries that are not necessarily involved in the conflict, but they may have made a statement, for example, that they have stated that they believe that the sanctions should apply to Russia for its illegal annexation or occupation of Ukraine. And then immediately you see cyber attacks starting to happen. So even if you are not involved in that conflict as a belligerent country, or as an organization that is involved in any way, shape or form, you're still becoming vulnerable. So it is important to bust some of those preconceptions about who's affected, but also how things are affected. It's not just about financial shutdown. It's not just about operational downtime. It is also important to use that in normative discussions. So there are ongoing at the moment UN negotiations around cybercrime for a new convention, and the open-ended working group, which sits in New York, to discuss the use of ICTs, where there have been discussions ongoing for many years to develop normative framework, the norms that should ensure the appropriate use of technology or the appropriate responsibilities in relation to cybercrime. What we find in those discussions have started to have been really looking at actually undermining some of the existing protections that are there because of the negotiation stance of certain countries who are actually informing those processes and saying, well, look, it's not an attack in Ukraine unless there's actually been any harm. And because it's only a temporary shutdown of a system, there's no harm, ergo it's not an attack. Well, if you're only measuring harm in a very limited way, then there is a risk that those normative discussions end up developing policies and norms that we should be following, which actually do not reflect at all the operating environment with which we're in. It's also how do we look at reducing impact and increase accountability? Because for victims of cyber attacks, how do they go about understanding how they've been affected, communicating how they've been affected, knowing what redress that they may have, whether that's at an individual level or a state level for example, criminal prosecutions that might come. And we see a lot of the threat actors today, for example, in Ukraine, there's been a lot of self-attribution. If you see that on the slide that Emma showed before, more than 80 threat actors, many of which have self-attributed and said, we have carried out the attack. So if we can measure the harm that's been linked to that, and then look at the impact really of that cyber attack, that could lead to a prosecution either domestically in the country where the attack has happened, or also at an international level. So those things are going to be very important to understand and actually be able to frame what those harms mean. Increasing public awareness is critical because we hear a lot about it's not just when, it's if a cyber attack happens. but people don't necessarily understand what that will mean for them. And so if we can raise the public awareness about all of the things that we were just discussing earlier, then it will really help to bust some of those myths and actually have a greater recognition of what harms and impacts are. We're also moving into an environment where cyber risks are increasing, and there is a permissiveness around accountability for those attacks that are happening. It's allowing perpetrators of those violations to continue to not be brought to justice, or to create an environment where attackers feel they won't be held accountable. If we can frame better the harms and impacts, it is clear that these are not victimless crimes. They're not computer crimes. They're not crimes that happen just about technology. They are affecting people. And I think that is very, very important, particularly for decision makers who are framing policies and laws today and in the future. And it will help or contribute to improve stability in cyberspace, because there's a growing distrust in the use of technology, the fear that our phones spy on us, or that we shouldn't go online because of the risks to us, or that certain technology is a worry. And so, or countries worrying about backdoors to use certain technology. So, understanding harms and impacts and being able to use that to frame the public awareness, the policy decisions, and hopefully greater accountability can all lead to improved stability in cyberspace. And then there are some wider, broader implications that we have to look at. So I mentioned, there is a very lack of accountability. There is this changing normative environment. The regulatory environment is changing quite quickly, dependent on different regions or different countries, but where you do have to report, like on GDPR for data breaches, where there are high fines for those organizations that haven't reported breaches, or on attacks on the healthcare sector, for example, in the US, where you have to report on those above a certain threshold. All of the implications of those that more tighter regulations and then compliance with those regulations will need also an increased awareness of what the harm is. We know the risk of attack is high. Can we reduce the impact if we understand more what the impact is? And then there's also the wider sort of sense of trust in technology. If you look at the fear or the awareness around cryptocurrency and the perception that that's the currency of choice if you're going to carry out a ransomware, that also builds or prejudices certain technology, and that's also a risk for society and risk for technology. And then look at the enormous costs that organizations and individuals are having to deploy in order to prevent cyber incidences, defend against them, and respond in terms of their own capabilities inside to build a more resilient organization. All of those are the broader implications of the recognition of the harms and impacts which go far beyond those which are just the risk to the organization of its financial or operational shutdown. To conclude, therefore, we've been working on this methodology. We are now engaging with the wider community, cybersecurity experts, governments, international organizations, the private sector, other civil society organizations, academia, insurance, to really take the methodology that we've been working on, take the questions that are still there, and then work with the community to really try to look at how we can reinforce this methodology, how we can build on this methodology, how we can strengthen it around the data collection, around the identification of indicators, measuring over time or measuring different types of attacks, with a view of then looking at also how would we be able to make this methodology something that does become a reference point. So over the next months, we are engaging with different actors across the different sectors, and we're very interested to have any feedback that you may have on this work. And with that, we will then also obviously clearly be making this methodology public later in the year. So thank you very much for your attention, and we're open for any questions.
Thank you.
Please raise your hand for questions.
Hi, thank you. I am a big fan of trying to understand, impact and harm. Sorry, those terms are a little bit close to one another, right? So I might not use them the same way that you do. At the same time, I'm trying to figure out who's the primary audience of this message. Are you trying to convince policyholders to implement this framework? Are you trying to convince industry? Are you trying to come up with a new vocabulary for NGOs to use? Could you help me understand where this fits in?
Certainly, the big gap today is that we all talk about these things in very different ways. And I think that's a challenge, particularly when we're trying to inform both victims of those attacks, which is primarily for us, the humanitarian sector, health sector, critical infrastructure sector, but also states that are making decisions about this and are influencing, or the only ones who can really take positions in these US fora about what these harms and impacts are, because that will help inform those policy decisions. So definitely at a state level, it's very important. And we see, and the feedback we get is there's a big gap for them in this regard, and they would like contributions that can come. But civil society organizations, we can't and shouldn't be doing this alone. We should be engaging with all the different actors that can help inform that, but also can build on work that's already been done. So I think our appeal is really to have a wider sense of engagement from different actors so that it can then be used as a methodology which is going to help, particularly in decision making and for stability. Emma.
And just to touch also on the notion of the NGOs and the non-profit organizations that we're supporting as part of our assistance services at the Cyber Peace Institute, it's actually, there is still a lack of awareness of what a cybersecurity incident can actually do to your operational activities. This is happening every day, and it seems to be, let's react post a major incident. So to be able to actually measure that impact and harm in a way that is more tangible, the idea is to raise that awareness, to get people to think about how they actually increase their cybersecurity resilience, to be able to reduce the impact of a cyber attack. We can't prevent every cyber attack from taking place, but we can certainly raise the awareness for them, for the need for them to actually act before it's too late.
And to build on that, I think one of the organizations we've helped, quite a number of organizations that have been going through cyber attacks. Interestingly, they came back and said even after the attack was over and they had, whether it was a fraud or whether it was a breach into their systems and interference and disruption of their systems, looking back and said the psychological impact has gone on far, far longer than the actual recovery, and that was completely underestimated. And they needed to also use that sort of information to help inform and support the staff as they were going forward. Not just then to have processes in place to build a better resilience to that, but also looking and saying, wow, how do we overcome that? How do we manage that? And a lot of the leadership of those organizations, which are often being targeted, is saying, we are not armed to be able to do that at all. So I think on many different levels we can play this. But I think for the organizations themselves also to realize it's normal to have an enormous psychological impact of an attack. That would be part of it. And that is an impact or harm. That's really important.
Thank you.
Oops. Hi, thanks for the talk. So I fully agree with the message that you're trying to convey about the importance of measuring harm. Though in my experience, every time I try to propose like a policy change, the people in charge ask for sort of a real measurable number. Like you seem to agree with this. Do you have any sort of advice or a preferred framework to attach a number to, the predicted harm caused? Thank you.
For prediction or for
predicted
measuring?
caused harm?
Mm-hmm. So I think we go down to the slides that I potentially whizzed through a little bit quickly, is the notion that what is a measure? And that measure can be a numerical measure, a quantitative value, like it can be a qualitative one. And sometimes the message that is clearest to get through is what qualitative information is actually telling us. And it's converting that qualitative information into something that people relate to. And so the way that we are really constructing this from our perspective is to say we need to pull on many things. We need to pull on the fact that there's a financial cost to an organization. Yes, that's going to make the CEO wake up. But there are going to be other components where we're going to be able to say to an organization, if there is a cyber attack that's happened on a hospital and you have 5 doctors that are going to be unavailable for the next 4 weeks because they are so traumatized by what has happened and the fact that they haven't been able to deal with emergency care patients, that is something that should speak to many people. And I think actually by using the business impact, so the part that I was talking about, the organizational impact of harm, we're so removing it from the human impact that actually it's difficult for us as humans, as individuals, as people to relate to. So I don't know if that answers your question specifically, or if Charlotte, you want to.
Yeah, and I think we looked at the healthcare sector, for example, and we brought, we ran a process of multi-stakeholder engagement where we put in the room cybersecurity experts, we put in those responsible for hospitals, the administration, finance. We put governments, we put civil society, international organizations. And what was very interesting was they're all speaking very different languages. There's very little engagement in those that we brought together with actually those who were making decisions about budgets on security, or because they were very much reading the notion of risk very differently, and also the potential impact. So by putting different stakeholders together, it is a way to help build some sort of methodology that can inform and speak a language that could combine or unite going forward, because so far it's very siloed. And I think coming up with a methodology that can help break down those silos, or where at least they're speaking some sort of common language so that they can that everybody can adhere to, I think will help as we move forward.
Thank you.
Any other questions? Thank you very much for your talk, for your insights.
Thank you.